I had a patient come in several years ago, January. Over the Christmas vacation, she had been to the emergency room a couple times for rapid heartbeat. In fact, it was so rapid that the doctors thought it was impossible and tested it a few times because they couldn't believe how fast her heart was beating. And she told me that her heart had actually been beating faster before she went to the emergency room and they measured it. And she said, I mean, her whole shirt was vibrating. What they wanted to do, the typical intervention for this in a severe case, is to go in and burn out some of the nerves in the heart. Now, in my opinion, we probably need most of the parts that we have in our body. Occasionally something has to be removed, and medicine is great at doing that. But sometimes things need to be removed or are removed when something else maybe was the problem. So I asked her to not go get the surgery right away. A little risky on my part, right? We're dealing with the heart. And I found a problem in her neck and I said, I think this might be relevant. I went down, I ran my hand down her back, and right in the top part of her back, there was one bone that she almost screamed when I touched it. It's one of the bones where nerves actually come out and go to the heart and come from the heart and go back up. Now the heart gets its innervation from a couple of different places, not just the spine. But when that bone was that tender, I thought, okay, this is probably a mechanical problem, not an organic problem that needs to be dealt with surgery. So I said, don't do the surgery yet. Give me a little while. Let's adjust your neck and see what happens. I adjusted her neck. The hot spot in her back, upper back, went away, and her heart calmed down. Every once in a while it would come back and we'd check the neck, and sure enough, she was out of alignment again. But so I know from direct experience, and I've had other patients after that, not as dramatic, that the neck can affect the heart.